good evening, good morning, colleagues across many lands. We're so delighted to have you join us this afternoon at what I think is a seminal capstone of a very exciting visit and the beginning of an in-person conversation about our partnership with the University of Michigan. And I am so delighted to be the host and the moderator for this panel discussion. And I will not dwell in so much of introductory commentary. I just want to say that the discussion is going to be around co-designing for impact. This is really how we're modeling the partnership between Aga Khan University and University of Michigan. This is a partnership that is anchored deep in the doing, not in a lot of conversations, but in actually creating consequential data that will support many of the development and the health intervention work that our colleagues are involved in. So I would like to launch straight into the conversation, and I would like to introduce our speakers. I'll start with Dr. Akbar, who is our colleague and anchor partner in terms of his involvement with the project that they'll be talking about in a short while. And I'll ask him to say a few words and introduce himself and talk about his role in the project. So Akbar.
So thank you, Alex. So my name is Akbar Waljee. I'm a professor of internal medicine at the University of Michigan and the director of the collaboration between Aga Khan University and the University of Michigan. I'm also the co-partner and sort of the helping hand for Amina Abubakar, who is the PI on our NIH-funded grant called Utilizing Health Information for Meaningful Impact in East Africa Using Data Science. And I'll pass it on to Amina.
Thank you. Good afternoon, everyone. Good morning. Amina Abubakar. I'm a professor at Aga Khan University and director for the Institute for Human Development. I'm a developmental psychologist by training, and I'm the co-director PI for the UZIMA hub. Thank you.
Thank you. And I would like to thank Amina for choosing her dress today to say "Go Blue," because it's such an important chant for those of us at University of Michigan. My name is Joe Kolars. I'm Senior Associate Dean for Education and Global Initiatives at our medical school, but I also direct our Center for Global Health Equity, which engages all three of our campuses, all of our schools and units at the University of Michigan.
Carl.
Hello, I'm Carl Emerin. I'm the Provost and Vice President Academic at the Aga Khan University. And it was my great pleasure to work with Joe and Akbar and Amina and Zol and Alex and a cast of dozens of people to support the effort of the principal investigators around the application to the US NIH for the UZIMA project.
Great. And last but not least is myself, Alex Awiti, your moderator. I'm the Vice Provost at Aga Khan University, East Africa. So I'll start into the discussion and get Carl to first weigh in on the big picture. How did we get where we are with Michigan in this journey?
Well, the story of how University of Michigan and AKU came to sign our partnership agreement is really a story of conversations over many, many years. And then all of a sudden, the winning conditions just appear. So many of you know Mr. Yusuf Kasabji. He's one of the leaders in Kenyan civil society. He was a trustee of AKU until just last year. And one day he sent me an email that there's this guy at the University of Michigan that seems really, really interested in working with Aga Khan University. So that message is not unusual. We get many messages of people really keen to work with us. But he said that Akbar had a history in East Africa, so that was a big point. And University of Michigan is, by many, many measures, and perhaps most measures, the leading public university in the world, certainly in North America. And when I was Dean of Arts and Science at the University of Toronto, Michigan was my benchmark. Everything I did, I compared to the School of Literature, Science, Arts at the University of Michigan. We were roughly the same size, roughly the same age, roughly the same scope, vastly different funding levels even then. But on an academic point-to-point comparison, Michigan is the place I went. So here comes Yusuf Kasabji, someone whose advice I take very, very seriously, and it's at Michigan, so I sent an email. And that, as the story goes, is the beginning of something really quite special. Of course, I checked in with our president then, Feroz Rasool, and the first thing Akbar did is situate me with the Center for Global Health Equity, a very important title in my experience, and his person, Joe Kolars. So I said, Feroz, I'm told Joe knows us. And I get a page and a half. And if you know Feroz, it was a big email when you got 5 lines. So I get a page and a half on this Joe Kolars guy, and I said, this is going to be an amazing relationship. And then fast forward, not very long, a year or so, and here we are. So that's why Michigan. We knew Michigan. We had bona fides for Akbar, and we had an ongoing conversation with Joe that went back many, many years with the president of AKU.
So Joe, beyond just Akbar's interest and eagerness to work with us, and of course, Feroz's gigantic endorsement of you, why he...
Boy, there's 3 reasons that jump to mind. One is somebody who's been in the global health space for about 30 years now. Aga Khan University has always been a center of excellence for producing graduates that have permeated all aspects of academia in the United States. We've had top faculty leaders at our University of Michigan who have come from Aga Khan University. So we've always known it as a center of excellence. A second reason is just the core values of the university. The core values are very much centered on the public good, advancing the well-being of society in a very selfless way, and actually taking that on in a more challenging part of the world. As we all know, University of Michigan sits in the land of privilege. But Aga Khan University has taken on important values of enabling the individual, enabling women, enabling the marginalized in a more challenging part of the world. The third aspect that was very attractive to us is just the practice of the science and the art of collaboration. Starting off in Karachi, Pakistan, they've moved on into 6, 7 countries where they're committed to partnering, enabling, and doing the kind of co-design approaches to growth that I think is absolutely critical and fundamentally attractive to us. So knowing that there was the potential for a shared space to exercise our values and learn from each other in Kenya, with Kenyans at the heart of it, was very attractive to us.
So just before I let you off the hook, in terms of being intentional, what do you envisage as the benefits going forward of this collaboration? It's still very early in the day, but what, beginning with the end in mind, what do you want to see?
So the core missions of the University of Michigan, much like Aga Khan, is centered around they're an academic institution that are really committed to research, education, and service. And those are fundamental values. What we're particularly attracted to at Aga Khan is their commitment to measure success in terms of how they're transforming society. Sometimes academia, particularly in places like the United States, can get trapped in their own ivory tower, where they're advancing an academic agenda, and not necessarily the metrics that we would like to see in terms of people living better, living longer. So we realize we have a lot to learn from Aga Khan in that regard. But at the end of the day, we're looking for ways that we can enable our students and our faculty to make a difference. Those of us in universities should be viewed as complex problem solvers. I think a lot of the problems are emerging in low and middle income countries. But I also think that's the site for tremendous innovation and growth and opportunity. So we really welcome the chance to partner with people to explore that area. It's core to our mission of discovery and education.
So Carl, before I get to Amina and Akbar, from your perspective, where do you want this to go? You know, this is pretty magnificent for Kenya, coming right in the heels of Charter. As you've said many times, we are grappling with just the reality of AKU as a Kenyan university. And after Charter, literally, what does this signal for you in terms of your vision of AKU projecting itself in a different way in the Kenyan landscape as a fully formed academic organization?
It's a critical and it's a hard question. I've worked in very, very large institutions where the answer to that question would be something like, we will do anything that our academic colleagues choose to do so long as they do it extremely well. Everything's on the table. At AKU, we have a very special mandate. And it's a mandate that's brought to us by our chancellor, who is the founder and the major benefactor of the institution. And he gave us a four-part mandate. We are to have impact in the regions where we exist. And this becomes pivotal in the migration from one of 6 campuses in Kenya to a Kenyan university that is one of 6 parts of a global university. We are to have quality, relevance, and bring access, regardless of a person's ability to pay. So if you line up IQRA and you listen to Joe and his vision for the Center for Global Health Equity, there is an extraordinarily tight coupling. So we're moving in the same direction. So where do I hope to see this go? I have no idea what our academic colleagues will see as important or where they will choose to spend their time. And in part, it's where the money comes from. But whatever we do, it will have to pass through the 4-part lens of IQRA. So where do I want to see us go? I want to see us as a Kenyan university build the magnificent consortia among our partners and peers to better serve the needs of the populations in our East African countries, or in all of our countries if we expand it to the 6 areas. So we are taught that there is a continuum from spiritual life to our life in society. And in the East African context, as I've learned over 5 years, and that makes me barely knowledgeable on anything, as you know, you keep trying to keep me straight. We have a societal imperative that welcomes what we're trying to do, embraces honest, equal, win-win partnerships like with Joe's group. And wherever we spend our time, and there's a tremendous ideas coming out of the week of discussions here this week, we will pass the 4-part test, and we will be able to say, we made this better. We, through everything we bring to bear, made this better, whether it's nutrition, maternal health, mental health, scientific infrastructure like biorepositories, data analytics. We will make it better, and we will do that by marshaling the resources of very strong partners like Michigan.
Thanks. So, Amina, early in the afternoon, you said that you couldn't find words, and I just want to make sure you can find some words now. So, you've lived all of your life in research. This is certainly not your first collaboration. What is uniquely special about this that causes you not to find words?
I think what's really uniquely special about this is the way we've co-designed everything we are doing together. You know, it's a very respectful relationship that recognizes we are coming with different strengths. Yeah? So let's say I can talk about myself as a PI. I've had multiple grants, but definitely not one from NIH as a PI. You know, so I'm not the grant writing, but not the NIH specific. What Michigan brings is really that expertise on how do we put together the grants. Yeah? And then the team from AKU brings a wealth of experience working in the field, you know. So whenever we are co-designing, we tell them, you know, in the field, these are the priorities. In the community, these are the new things. And you know, everyone feels capable and able to open up and discuss and bring in their strength. You know, data science is a new field for Africa. You know, we are really going into a new area, and we hope that 10 years down the line, AKU will be a center of excellence in data science. So for now, we are learning. Yeah? So I think what really makes this unique is that willingness to look at each other's strength and really support each other to build it up. You know, it was really a very, what can I say, challenging, very complex project to put in, and yet very enjoyable because of the kind of collegial relationships we developed, you know. So what is exciting about this visit, then we get to meet all these people. We had many, many emails with and a lot of discussions. So I think the key lesson in this partnership is that really respectful, mutual approach to collaborating and working together, looking at each other's strength. And actually, it's not just Michigan, AKU or that, you know, it's a large multidisciplinary team. Akbar and I just represent a small bit of the UZIMA. So different colleagues, a very multidisciplinary team. Everyone brings in their ideas, their skills, and we build on that.
So Akbar, it's not all the time that you get on your email and find a trustee of the university and express your deep interest and eagerness to work with the university. What, you know, you Kenyan background, your mom lives. Is there anything beyond just the academic interest? You're very big on community. How do we change? How do we impact the community? How do we get all of this data to influence decision making, but also shape innovations and change people's behavior and lives that then cause them to live healthier and longer lives? What excites you about this?
Yeah, so Alex, you know, thank you for that question. You know, as you mentioned, you know, I obviously have a mom that's in Kenya. I was born in Kenya. And all my life, there's always this been a passion to say, how am I going to come back and how can I get back to the community? You know, the intention was always to come back, but, you know, life takes you in different directions. Nothing is ever planned and seemed to keep on moving further and further north. So, you know, started off in Atlanta doing some education there, and then ultimately at Michigan, where, you know, I got married and have a family. But again, you know, subconsciously, there was always this, you know, nagging feeling saying, make sure that you're giving back to the community. And naturally, even though it was not planned and intentional, I gravitated over to the Veterans Affairs Hospital. Again, working with a community that, you know, sort of, you know, is marginalized, sometimes can be under-resourced. And I'm asking myself, how can I use some of the interests that I have around data science to improve the health of the community? And then, you know, over time, as you kind of walk through the academic credentials of making sure you have grants and papers, I asked myself, well, can I, again, maybe do something more meaningful? Maybe it was a midlife crisis of say. And I said to myself, okay, are there opportunities to do things back home, knowing that there was an institution there that really penetrated every part of community health. And again, I think we say this over and over again, it was those shared values, the mutual respect, and really this bi-directional learning that I felt pulled me back. I felt, with COVID and as an exemplar, a global problem needs global solutions, and you need your global partners. And innovation, like Joe said, really stems from places that have sometimes challenged resources. And I'm not talking about finances at all. I'm talking about just bandwidth, about the ability to get populations to meet tertiary care, a variety of different challenges. And ask yourself, how can I make a more meaningful impact using data science? And this is where, for those on the call, there was an NIH grant that called for using data science in meaningful ways across Africa. And this is where UZIMA, and again, I'm just going to repeat that what UZIMA stands for, but it's utilizing health information for meaningful impact in East Africa. And for those US audience, UZIMA means Wellness of Health in Swahili. Again, an acronym that just encompasses why we do what we do.
So, Amina, you talk about co-design, and Akbar just touched on some of the thematic areas. Talk about data science, these elements of mental health, and of course, maternal child health, and then the impact side of things. So, what were the discussions like in creating and shaping these teams? What was at the heart of the co-design process?
So I think where these themes came from, I would say multiple areas. There were multiple stakeholders, and therefore the different disciplines. Many people within our teams are either very stationed in the communities, very active doing work there, or doing clinical work. So we kept asking ourselves questions as, which are the key challenges we are now facing? Where are the gaps? For instance, with mental health, we have mental health experts who told us, here is the burden in Kenya. This is what is missing. Yeah? So the design process really comes from different parts, the global needs, but largely driven by the community needs and where we see the gaps within our context.
So, Akbar, in that exchange, because in many of our experiences in this part of the world, and we come from the tradition of the big multilaterals. The UN says this, we organize around those kinds of objectives. So the World Bank decides this is the funding priority for governments. So Africa has been the victim of somebody with a lot of cash and with some ideas that have worked in some context, coming into a context like this. You guys have talked about this respectful co-creation process. What was it that was a deep learning moment in that co-creation moment? When Amina comes and says, we talk to communities and these are the priorities. And in that space of these are the priorities, how did you conceive of what might be a meaningful addition with the experience that Michigan has and the galaxy of amazing colleagues that would then support the process of making this a meaningful collaboration? What was it? What are the flows from the Michigan side? We generate, like I said in my comments in the afternoon, that we live in a context of complex and really entwined problems that are in many cases are wicked in a sense. And what we offer is an opportunity for like-minded universities to grapple in this with us. How do you see the Michigan connection to come to bear on these kinds of issues?
So, the way I maybe more naively look at this is, what are the key ingredients that make a successful relationship, right? And part of this is that, East Africa, in a lot of ways, has leapfrogged a lot of the first world or high-income countries in the use of digital information, right? So just think about the penetration of mobile phones, right? There was a leapfrog, and Joe talks about this all the time, too. But not only that, there was a penetration of mobile phones and the use of financial services, right? Again, M-Pesa leapfrogged even the high-income countries in this space. We also knew that from the University of Michigan's standpoint, we have very, very strong schools. Those in engineering, the LSA, and we knew that we could utilize information in different ways to identify trajectories of patient health. Why not capitalize on these ingredients where mobile phone penetration or us trying to capitalize on where we are lagging in health and say, can we make leapfrog using data and data sciences in a way that can capitalize on better health? Now, traditionally, we tend to be very close-minded in how to utilize data in better ways or what kinds of data to use. We are lucky in high-income countries to have data like health, insurance-based data and other forms of data, electronic medical record data, and that digitized data to actually make, inferences. But sometimes you want to gravitate on information where information is lacking and say, what other forms of information, what social determinants of health can impact health? And can we utilize that information to make better predictions? And it's those ingredients and those strengths where we said, okay, well, we can come in and support sort of a data science infrastructure. But what we lack and what we want to learn from you is what are the needs that emerge from the health domains. And like Amina said, those gravitated to areas around maternal child health and mental health. And then, innovatively, we said, okay, let's not make the mistake of not engaging the community, and let's not make the mistake of not knowing what are we going to do beyond this grant. We want to start thinking about that today to make sure that however we disseminate our information will actually be sustainable. And how do we get data in the hands of the community so they can be integrally involved in the conceptualizing and also the application and execution of this grant? And I think that's what made us unique in our partnership, where we were thinking of all the domains and bringing our strengths where our strengths existed.
So Joe and Carl, we've kind of gone into the weeds here a little bit, but I want to bring it back up to you kind of strategic level. How do we keep this alive? You talked about dialogue as kind of an essential ingredient in sustaining the partnership. And suddenly two colleagues have basically said, this is the beginning. We're all looking forward to bringing in more of our colleagues from other parts of the university to work on these issues. Eunice Durang would just say she's going to be speaking about nursing, for instance, and how nursing might contribute to this. I'm sure in your community as well, in the Center for Global Health Equity, there's tons of individuals who are peering in, trying to figure out how they might play this. What would be your message to your colleagues when you get back after these exceptional experiences in terms of opportunity?
Yes, thank you. I think one of my main messages for my colleagues is this is where the solution making is going to be taking place in the years going ahead. How Africa is surging. There are a number of countries still struggling with low income status and are trying to figure out how to do more with very little. This is where the solution making is going to be taking place. And we need to be a part of that for our own future. What can we learn? What could we co-design, and how can we be making, contributing to solution making in probably the most dynamic environment where that's going to be taking place? So I think it's necessary for our future. Maybe if I could draw one analogy and use it as also an opportunity to make a distinction that what we're talking about here is health, not necessarily health care. I think a lot of the discussions have really absorbed a lot of the money, a lot of the energy around health care, where if we're paying more attention to health, we need less health care. So as Amina and Akbar have been talking, is really trying to put our hands around health and the data that reflect health, that predict health, that will guide health, and not staying focused on health care. With that introduction, I'd just like to introduce a small example of that's been part of University of Michigan's history. Unfortunately, the example comes from healthcare, so that doesn't generalize. But back in the 1800s, Actually, 1869, the University of Michigan formed the first teaching hospital. There was no such thing as a teaching hospital where sick patients came together, and it served as a classroom for people how to learn how to expand better care, how to do research. And suddenly this generalized across the country. Everyone had teaching hospitals, and it's a core backbone of our healthcare system right now. That we needed to activate that as a classroom and as a research center. Here in 2022, the classroom, the research center is in this part of the world. And that's what we need to learn from, to have the opportunity to co-design the future with people like Amina and so many good people here that are based here.
So Kyle, to you, how does this constitute potentially a model for AKU's East African research, and potentially globally? What could our colleagues out of the UK and Afghanistan and Pakistan learn from this? In a sense, you say that we want to go where faculty want to go, where our academic colleagues who drive this would basically be, so the frontier is that fast. But in terms of a coherent model, what did you distill from this one that we basically say, if we were to do it again, this is potentially a blueprint for an architectural design for research collaboration?
A couple observations. When the concept that we would partner with Michigan to apply to the US NIH for something this big landed on my desk, I thought, wow. I said, in my past, I've held grants with health agencies as a spatial statistics guy, and I knew immediately how tough this is. These are not easy to get. I don't know what the success rate is, but it's small single digits overall. And I just took a deep breath and I suppressed all of my anxieties. And I said, well, let's just see how far we can go. So that was that kind of existential leap of faith. But I knew it was going to take very large amounts of a lot of people's time. And on that point, I wasn't wrong. But how did we become so successful? Well, two parts. First of all, if you look, as I have now, at how Michigan creates their teams, they are very unlike my experience with many US institutions, and very much more like big German universities that I used to work with in another life. And you see, if you look at the list of the Michigan delegation, you see a whole series of people who are not full professors, but they are PhDs, they are teachers, they are managers, they are project specialists. And it's this rich wraparound of extraordinarily highly accomplished people in their own right who choose to spend their time creating the winning conditions for these kinds of applications. You don't see that very often in my experience, outside of some of the big European schools, especially the big German schools. So when I saw the team that was brought together, and I started watching how they moved us along. I'm looking at one of them over there right now. It was okay. So we're not on our own. And then I started thinking about, well, listen to your colleagues, Carl. They have not come through the usual propagation of the species called tenure stream academics. We attract people for many reasons, and they can tell their own stories. But if you look at those involved, they have many different pathways to come to this project. Amina, as you said, spent many, many years with Emerin. Anthony Gugi, I still don't understand how he decided to create this cohort, but all of a sudden, here's a population cohort. I remember when they told me about Anthony's cohort, I said, well, is it for real or is this a proposal? He said, no, he's been doing it for years. How has he been doing it for years? I don't know, but I'm glad he did. Marlene Temmerman comes from the Senate, comes from one university career, comes here and starts all over again and does it. Mansour Saleh, Zol Morali, every one of the people that are key AKU members have a very unusual career path coming to AKU. So it's the strong attractor of this notion that we will make it better here. So we have the rich capacity of Michigan to pull it all together, move us along, with a core academy that is very different from my experience over the previous 25 years. So I think it's this amazing organization called Michigan with this amazing organization called AKU, both of them unique in important ways, and they don't get too stuck on this won't work because I don't recognize it. They get stuck on, well, here's what we have to do to get there, so let's just get there. So I don't know if that answered the question,
Yeah,
but couple of observations.
Yeah. So to Akbar and Amina, you're really in the driving seat of this one, and impact is foremost in your mind. Akbar, day one, you talked about reciprocal innovation as a path to impact. How do you really see this with some examples? How, again, think with the end in mind, what do you want to see? You've got this amazing populations in coastal Kenya, and interesting priorities that intersect very tightly with the healthcare priorities of those parts of the world, of the country. So there's going to be, right from the beginning, you're going to raise a lot of expectations. The governments are going to be looking for evidence for policy, evidence for interventions, all of that. How do we see this panning out with reciprocal innovation? And for our viewers, for our listeners, what does that really mean?
Yeah, we have to acknowledge the fact that, different stakeholders have different values or different versions of impact. And Amina and I have talked about this all the time. And really making sure that we listen to all those stakeholders and delivering information that is digestible and understandable. I had a conversation this morning with the AKU's, Graduate School of Media and Communication, and really trying to listen to them to say, what is the information that we can digest that we can then take away to the policymakers and then to the population? And I think that's the foremost, right? Impact, sometimes defined as publications or grants, are not what we're aiming for, right? What we're aiming for truly is that we're going to have a meaningful impact in the community by improving their lives and really making sure that, again, we're meeting the metrics of all the stakeholders involved. I think, the example that you referred to in terms of reciprocal innovation, again, I'm going to bring you back to the current climate around COVID-19, right? Clearly, no matter how much money you may have in an individual country, may not deliver or drive the solutions. But again, sometimes being in an area where you have limited resources drives that innovation. And I think everybody is familiar with the kangaroo mother of care example, right? Where we're saying to ourselves, well, yes, we have incubators and these are expensive and they can be used for children with low birth weights. But we also realize that, the human body can deliver that equally well, and if not better, in terms of infections and mortality. And I'm looking and I'm searching for those examples to say, can we deliver those perfect environment where we can say, let's test these low-cost solutions in high-income countries, and maybe they could do better. Maybe they can help prevent unnecessary expenses. And I think that stems from coming into an environment just like this, where we're going to say to ourselves, can we use data in better and different ways? Data that we traditionally don't use, where it could utilize, cohorts like, Carl just mentioned that Anthony has developed in a colony Robai cohort, which is purely surveillance data. Is there meaningful information there longitudinally that we can actually use to improve the health of our population?
Amina, from your vantage point, having been during your days in Cambridge, those were your stomping grounds. You basically know those communities pretty well. What would keep you awake when you start to think in more concrete terms about impact? Joe and Akbar have been absolutely clear. This is not about stacking up new publications. That's important, yes, but it is not the ultimate goal. The ultimate goal, as Joe pointed out at lunchtime, is people's well-being and livelihoods enhanced. Some difference, some momentum going forward, maternal, child health, mental health status, etc. How are you conceiving this impact? And what would those pathways be for you?
An interesting question. What makes this interesting is it reminds me of, like 16, 17 years ago when I joined research, and early childhood was not an important topic. It was all about, reducing mortality, who is going to survive, Now the paradigm has shifted to surviving, thriving, and how do we transform society? And that has taken a lot of advocacy, a lot of small evidence from many different places that we need to invest in early childhood. So for me, impact would be that 10 years from now, there would really be a paradigm shift. One, that people realizes the value of data. They invest in it, but actually invest on how best to use it, So that would be a very important impact. In my career, some of the things that have made me very happy is to walk into a rural clinic and find something you developed, small things being implemented. So for me, impact would be if some of the models we are developing are actually being deployed and used in improving healthcare for those who are already unwell, but also because our grant is about early warning signs in developing promotion and preventive approaches. That would be impact. But I think also to really make an impact, it would be important to target different things. And I can just mention two things I'm very passionate about. Now, one thing I've learned in Kenya is we have youthful energy, we have talent, and impact would be really capacity building in this region, so that people can take this field forward, So as we retire, Akbar and I, we have these younger people around to take forward and all that. So I think institutional building should also be very intentional. How do we create conditions, facilities, infrastructure that attracts talents, keep talents, and really enables people to do good work?
So on that point, Joe talked about, the introduced Leon, Kevin at lunch, and say this is the pipeline. This is potentially a model for developing, and you working a lot with postdocs. So how do we build this deeper in our organizations? I'm looking at you, Carl, and we've been talking about this. What is that next generation of researchers at AKU? What is that future pipeline? And what would we be investing to make sure that happens? Of course, this tremendous opportunity with grants like this is to bring potentially postdocs, and of course the exchange that we talked about. But it's really how do we build that deeper and more broadly across our organizations? Yeah, both of you, because that's kind of a strategic question.
Well, thankfully,
Using the model of Kevin and
sure.
Leon, for instance.
That might require a description of who Kevin and Leon is, but for the group. But
yeah, we're thankfully we're both in the education business, core to universities, and of course research contributes to education, but we're in the education business. Our Center for Global Health Equity, one of the things we're really committed to is enabling students and trainees. We have a student over here right now who's spending a year working, learning, contributing to AKU, Kevin, contributing to new knowledge in the rural areas of Kenya. And then we have what we call an Impact Scholar program, which is basically a postdoc program for people who want to go very deep into the issues of global health equity here and other places. one of the things that I think is critical for us is to attract the best and the brightest to come into this space, to create learning opportunities where we can exchange students, where we can exchange trainees. We're very interested in co-supporting. Our center basically is just barely in its second year. We have our first cohort of impact scholars, but we want to extend that and include learners here in Kenya, where by virtue of this trip, there's 11 of us here from the University of Michigan. I have to say, at University of Michigan, we've all been kind of cooped up because of COVID, and this is probably the first time a large group have left the University of Michigan to explore. But one of the things we're really trying to explore is the co-learning opportunities. People like Carl and I, we need to make ourselves obsolete as quickly as possible. And Amina needs to move into these seats. You need to move into these seats. We need to get out of the way quickly. We've got a pipeline. So we're really attracted to, yes, I'm looking for opportunities for our learners, but we've already secured an intern from here, a Kenyan who wants to come over and study and learn at the University of Michigan. So the more that we can make people aware of those learning and training opportunities, for us to target funding in that direction and to prioritize that, because we're a university and we're both in the business of shaping hearts and minds, creating new talent, and we need to continue with that.
Carl?
Of course, we have an impact by forming professionals who are also leaders in society, and we will expand those. Of course, we have the traditional postgraduate education and all of the mobility efforts that Joe referred to. So that's a broad foundation. But we heard several times this week about the young teams. Farhana Alarakia tells us about her young data analytic team, and Zulmarelli tells us about the young team that he's brought together. And of course, the Uzima grant is going to bring very large numbers of young people together. And there's this theme, Amina's many grants, young people. At one point, a couple weeks ago, AKU had 400 vacancies for research positions across the academy in all of our countries, all of them for research grants, 400 people. Now, of course, my job was to keep our HR recruiting teams from dying at their desk. So there are things provosts get to do in the face of unbelievable success. But IGHD, that Zulfi Buddha leads, and the Women and Child Health Center of Excellence. But are we just like scattered to the wind? No, we're trying now to organize all of these through the lens of the United Nations SDGs. And it gives us an opportunity to think about what we're doing and how we can better present. And then just when I think we're settling down, just when I think like, okay, the German in me is happy, it's organized. You get a call from someone like Mansour Saleh who says, I'm tired of where I'm working. I want to come and I want to teach the international community how to better treat cancers in Africa. Like Akbar, he has a personal story. And I remember asking Mansour, like, oh, sounds like that's the first year. What are you going to do in your second year? Like, this guy shows up. I'm going to train the entire international pharmaceutical industry to treat the African population fairly and respectfully. Well, holy cow, that's not a small item. So you take a deep breath and away you go. And then I'm sitting in a hotel, I think it was in Toronto, and I meet this guy, Zol Morelli. He says, the burden of poor mental health, and I knew this from my days in government, the incredible burden on self, family, and society of long periods of untreated illness and just poor mental health is a staggering bill that society pays for which we get absolutely nothing in return. So, except if we don't do it, pain and suffering. So it's a critical issue. So what does Zol say? I'm going to come and I'm going to take everything I've done for 20 years in Canada and I'm going to bring it to AKU and we're going to be the standard for how to do this better. And I thought, holy cow, here we go again. So we never really have a chance to settle down before someone comes and says, I've got this bold, audacious view. I don't have any of the resources, but we're going to do this. And then I say, okay, and here we go. And I think Uzima is an example like that. So I don't know what we're going to do next week, next month, next year, but I do know that someone's going to come knocking on our door and it's going to absorb a whole bunch of young people. And we're just going to take another deep breath and we're going to launch. And like mental health, I have no doubt that when Zol's finished, it'll be better. The evidence from Mansour is already that it's better. And we just keep going, keep going, keep going. And obsolescence sounds extraordinarily attractive on a busy day. I have to agree.
Well, you realize we're the only two here that weren't born in Kenya. So
There is that.
yes, so we're at the other end of it. You know, Carl, you mentioned something, forgive me, Vice Provost, for just, maybe you could clarify for the audience. You know, Aga Khan is a global university.
Yes.
What countries are you operating in? And I know, again, you're in the talent business of developing talent and getting out of the way. You're an enabling university. But where is Aga Khan University active beyond Kenya?
So we have campuses in Pakistan and in Afghanistan. And in another day, in another venue, we can talk about what it means to operate a specialist women and child hospital and postgraduate medical school and nursing school in the middle of what by most descriptions would be something akin to a war zone, but we'll just park that.
And where is that? Just
Kabul, Afghanistan.
Kabul.
London, England, in the 1500s, 1400s, Toledo, Spain was the place where the three great monotheistic religions came together for common cause. Now, arguably, that's London. And I think it is an inspired choice for our chancellor to put the Institute for the Study of Muslim Civilizations in London, where we can have common conversations with all of these amazing organizations. And then in East Africa, Nairobi, Kenya, Kampala, Uganda, and Dar es Salaam, Tanzania. Coming on fast will probably be some developments in Lisbon, Portugal, in the not too distant future. And now our sister university in Central Asia, Kyrgyzstan, Kazakhstan, Tajikistan, our borders are blurring. So we're both working in Afghanistan. We're both working in northern Pakistan, cities called Gilgit and Chitral. I expect before too long, we will both be working in Tajikistan, because on the opposite sides of the boundary river are communities that are very, very similar. Kyrgyzstan is rapidly developing. Kazakhstan is just getting up and running. So AKU, UCA, 6 + 3 + 1. And then there's our partnership networks in Ann Arbor, Michigan, Baltimore, San Francisco, Toronto, Edmonton, Vancouver, the list just goes on and on. So it is a common day where we have meetings that span roughly 18 hours in time zones far removed east and west.
Is Aga Khan University a for-profit school? Is this school here in Nairobi for profit?
Oh, no. No, my deal with my boss, they raise the money and I'll spend it plus a little bit more. So we are resource starved. We take all of the revenues from the hospital that are not used to run the hospital or to treat patients for free. We have a very expensive, very successful patient welfare fund. I forget the number, about 20% of our revenues. We immediately plow back into student support, patient support. We get money from many, many places, but we are so far from for-profit that there's not a really good word to describe except not-for-profit, seriously not-for-profit. And we are very proud of that. And I have every reason to believe we're going to continue in the same spirit.
So we're getting questions from our colleagues who are online. And one of the questions is, beyond grant proposals, what are the other platforms for allowing AKU and Michigan faculty to collaborate?
Well, to begin, and this trip is an example of that, is to find ways to connect kindred spirit. So I see this platform is serving a major enabling function. So when Amina has a need or an opportunity or a learner and could say, do you have somebody at Michigan with these kinds of interests that you could connect me with? We want to be the connecting service. And the same as people get more excited. Right now, our latest estimates at the University of Michigan, we have about 80 faculty who are involved with Kenya. And if all of a sudden they're aware of this platform, can they get further enabled and supported for that type of activity? Learning activities where learners can be placed bilaterally. And shaping programs for impact. We want to try and, as Amina and Akbar are leading us, how do we design creatively when you've got a partner in a high privilege, high income country and a partner in a low income country? How do you find common ground? How do you write the field manual to make that happen in other places? How do you establish a new model? So I think there's a lot of other opportunities beyond just a grant, achieving grants or finding the pilot money to get in line for external grants.
Amina, go ahead.
Now, one opportunity I learned of very exciting this week are the challenge groups. You know, for instance, one that I'm really interested in is a challenge group for empowering women and communities. And, you know, this is just an opportunity for people to dialogue. So I've spoken to Amy, who is the manager, and I will get an opportunity to present my interests there, start talking to people and just see how it goes. What is it we are interested in? For instance, now IHD is setting up a Women Leadership Academy. I've spoken to Amy, and we'll just start as a small, tiny group between Michigan and AKU, you know, just talking around women leadership issues, mentorship, supporting each other, and then we see how that develops. So I think, you know, like these challenge groups where people start discussing things informally, learning about things would be also a very important platform for people to collaborate, develop ideas, and, you know, just see how things develop.
Jerry, I wonder if you want to say a little bit about the challenge groups as a medium for connecting people across campuses.
Yes, at the University of Michigan, when we were trying to again survey our stakeholders within the campus to say where do people want to have impact, we decided on a model of creating communities of interest, communities of practice that would bring together faculty as well as learners and staff. And four suddenly came to mind. People who are really interested in partnering around strengthening systems for health. So many of the systems that we are part of contribute to somebody's health. the healthcare system is maybe a part of it, but when you think of education systems or the systems that contribute to the economy or the systems that are impacting the environment negatively, how can we strengthen systems for health? Who are the stakeholders who are interested in partnering respectively, respectfully with those in low-income settings? Another one is the technologies to advance health. I think there's going to be a lot of breakthrough technologies in this part of the world. That's a challenge group. And this is, again, a community of practice where people come together, brainstorm ideas, bring in their partners, apply for pilot funds to get grants. A third one is around the social determinants of health, particularly around the climate and environment. Anyone who's not thinking and talking about the climate and environment right now, I think they're a bit tone deaf in terms of what's going on in the global, what I've learned in this part of the world about the impact of what's going on in the climate. And then the fourth one is that one that Amina was just mentioning, empowering women and communities. Women they take care of their health, they take care of their families, they take care of their communities. They need to be enabled and supported as much as possible, as opposed to being held back. So these are where our faculty are coming together. We're reaching out and trying to establish co-design approaches with that regard.
So those are kind of tremendous mechanisms for connecting. But Tal, how do you kind of keep calm colleagues who might say this is a privileged club for only research active people like Amina? Where would our teaching intensive colleagues find a toehold in this strategy?
There will be many benefits that our students in learning environments will reap from this activity. The data, the examples, the techniques, the mobility that will allow our academic colleagues, not just our research colleagues, but our teaching colleagues who travel to our partners, Michigan and elsewhere, for experiences, for advanced training, for advanced degrees, and they come back and they bring all of this into the classroom. Many of the colleagues that work on these grants also have a teaching role, a mentorship role. I wouldn't want to count how many of our young academics I've said, well, you really ought to go talk to Amina because she's got a lot of experience and she has traveled the path that you are describing for yourself. And there is nothing better, and we all know this in our experience, a strong mentor who's gone before you, picked up a lot of ways of adjusting, but also along the way gained great wisdom to help the next generation move more quickly through their learning phase. So this is not a research university over here and a teaching university over here. We're nowhere near large enough to have separations. So the strong positive feedback loops are many, many fold. And we will see that as we turn on our undergraduate medicine and undergraduate nursing here in the next year, we expect. The other way we can bring all of this together in the classroom is, again, to be faithful to our four-part mandate and reach into society and bring it into our teaching environments. Kenya, East Africa, unbelievably young population. And if you watch the media, it is dynamic, the literature, the arts, the fashion, the music, the agricultural innovation, the industrial innovation. You're the expert. It is an amazing incubator of energy, trying to make a path and find a place for itself in a broader world stage. And we're small. We're not going to replace the massive universities of Nairobi, for example, but we can bring evidence of focused practice like the Media Lab in GSMC that Joki's involved with and you guys met this morning. So I can be precise, I can send in lists of examples, but the evidence is strong and it's growing. And Amina may want to share some of her own experiences in her multidimensional existence that is way more than just director of a research institute. Ask nursing, ask medicine.
But Akbar, you're an educator at heart, and we will be studying 2 large undergraduate programs next year in nursing education and medical education. From all the products that will be coming out of this amazing work, how do you think we could utilize some of these kind of real-time, absolutely context-relevant findings to influence how we educate nurses and doctors? So I'm talking about curriculum here as a potential mechanism for connecting, not just through AKU, but could some of this find its way to Michigan and just really revolutionize how we teach, for a contemporary society?
Yeah, I mean, you bring up I think you bring up a good point. I think learning has changed, right? It's no longer looking at a textbook and answering questions 1 through 20, right? It's really contextually based. And the more you can put learners in the environment where they will actually thrive and can actually participate, I think we'll get the most out of them. But as you talked about, look, how can more and more of our folks on the webinar and others participate? The way I perceive this, again, this is my naive way of thinking, but I think it influences how we do things, is that it's like an onion skin. That outer layer is all about shared awareness. The webinar is an example of shared awareness. What is going on? How can people engage? The second level is saying, okay, maybe it's the challenge groups. They can then participate in the challenge groups to find and identify like-minded folks to engage with. And then there's things like Uzima, which is one of many enabling functions of grants. And I'll have Amina speak a little bit about this, but as part of Uzima, this is a research hub. Uzima is around identifying many ways to engage with health and data to actually have meaningful impact. And as part of this grant, we actually can facilitate many other projects where others can engage. And maybe Amina can talk a little bit about that and how she sees us engaging more with the community at large.
So I think there are various practical ways, and that is we are really open to collaboration. Actually, the way Uzima has been designed is we still have money where we can subaward small projects. So around June this year, we'll give out a call and people can compete. So already people can start talking to us about ideas. The key thing is that Uzima and the DSI is really meant to focus on African data, So any ideas about how we can do that, that would be great. Therefore, colleagues are really invited. Now, also as part of the dissemination and sustainability core, we're going to have various public engagement processes. One, for instance, the Social Science Cafe. We will call people who are both experts and non-experts, colleagues outside our, the hub, and we will have discussions about the results we've had and get feedback and, learn from everyone. Yeah, so we will buy you coffee, Alex. We will ensure these cafes have some coffee and all that. And therefore, I'm sure more colleagues can come in. But actually, I was just speaking to Anthony Ngugi, who is the head of population sciences at the moment. And I told her I have really talented postdocs. They are doing research, but it would be nice if they interact with students. So when you have programs, courses, I would like them to come in and give guest lectures. What happens is that they give information. Like if you're teaching about research methodology, you could sit down and do something from a textbook, or you could actually get someone who is actively engaged in research to come and teach that and explain to the students, share real-time field experiences. I benefited a lot in giving guest lectures as a postdoc. And when I was teaching, I always got to bring in people who are out in the field. So I think that interaction between research and teaching can really work well if research institutions have collaboration with the teaching departments and we kind of collaborate.
You want to come in?
I would, thank you. For somebody who leads education in a research-intensive institution, one of the things I'd like to see is people to have a much more enlightened view of what it means to do research. Sometimes research can be a dirty word or off-putting to some. I want to do global health. Oh, I'd love to do something there in Kenya. Not really interested in research. It's something that we often hear from our learners. But I challenge them to say, well, people, it's going to be selfish for you just to come and absorb. Aren't you interested in making something better? No, I'm interested in making something better. I'm just not that interested in research. Well, to make something better, you need to be able to measure what it is and then know if you've improved it and then share it with the world so it's generalizable. That's research. But a lot of people seem to have a pinhole view of what research is. Education for me is one continuous set of experiments. How we teach, how we learn, it's a huge research environment. I feel like as an education dean, all I do is research on how to make the curriculum better, assessment better. I wish people had a more enlightened view of what discovery means, a commitment to making things better. And research is a methodology, but I think there's a lot of room in the tent for people who want to make something better. If people just want to hang out and maybe create a distraction or draw off resources, not so much. But if people are interested in making something better, figure out how to do it, and research is a way to really execute on that.
So I guess we should be kind of winding this up. Do we have any more questions from the audience at this point? So as we wait for that, I think, just some reflections, given how all this started, is there anything that could have done better under the constraints of COVID in terms of the journey to this point? And I'm looking at our two colleagues who've been in the driving seat for this one. I'll start with Amina. Is there anything that you wish you could have done better, differently throughout this process?
Honestly, I can't think of anything off the top of my head. I would say maybe time. By the time we learned about this, got together and wrote it, the time was a bit constrained. One of these projects we had that had a slightly different model is that you wrote the first set of applications submitted, and when it was moved to the second stage, we had a community consultation process before we actually submitted the full draft and kind of co-designed it with the community. With this one, I think there wasn't time for fully going to consult. Akbar and I have discussed, and we're going to do more community consultations as we roll out the studies. So actually, to be sure, the questions we are asking are important to the community. Absolutely, that we don't go 4 or 5 years down the line and people tell us, but well, it could have been this a little bit. But when generally, for such a complex study, I think we have done our best. There's always room for improvement, but I don't see any regret. I think it will be a learning process and it will get better. And I must thank the leadership both from AKU and Michigan for their support. And also not just to forget our partners at Cambridge Wellcome Trust.
Yes.
Today we have 2 of the 3 partners for Zima. And, Cambridge has been very generous in the way they have approached this. They have been part of this week's discussion, really adding additions. So the key lesson has been, if you build good partnerships, you can carry them over even to your next place. And yeah, so I don't think I have much I would change. There will be room to improve things, but I think.
Akbar, I'm sure you wished you were here.
I think that's the only, so it's a moot point because we got it successfully funded, right? But to be able to engage in during a COVID environment not only talks about our ability to adapt and to work in a constrained environment of just, sharing information and writing a grant together. But, I think we successfully did this. Again, just because the grant got written with maybe a few people and a few institutions, we're welcoming. We really want to share this grant with everybody that wants to partake in this grant, because I think we have the resources and we want to really make sure we engage the community in any way possible.
So just since I still have you on the mic, one of our participants is asking that, stating the research is not the only path to impact. What about actual implementation? So really the continuum from the questions, the research, the evidence, and to action through implementation. How do we see this work? And I think in there is loaded questions about partnership structures, engagement with policymakers, with community leaders, with household actors, etc. So what would be your response to this person? I'm sure this has been thought through. So can you walk them through thinking?
Oh, for sure. So I'll actually start off by just talking about the structure of the grant, because I think it helps answer some of the key questions, and then hand off to Amina, because I think this is where her insight and her values truly come from. But the way the grant was structured was that we had to describe an administrative core in 12 pages. We had to talk about a data and method score in 12 pages. And that was only requirements, is to have 2 cores to facilitate research. Then we had 2 key questions that came from our knowledge experts locally, which was around maternal, child health, and mental health. Each were 12 pages. But we felt that there was something missing, right? That was the research element of things, the administration of the research, the ability to do analytics, the ability to pick 2 health domains. But we clearly realized there was a dissemination and a sustainability core that needed to be added. Right? This was an additional 12 pages that we weren't even asked to write, but we wrote, because that really encompassed everything that you talked about in terms of implementation and evaluation. And maybe Amina could speak a little bit about what that means and what that involves, but again, it gets to the whole point of implementation, actually execution.
Okay, so within this dissemination and sustainability core, we've brought together various experts. So we have experts in community engagement and ethics. We have health communication experts. We have experts on social entrepreneurship. So it's business, but for social good, So, and actually medical anthropologists. And what really we want to do with this core right from now. So one of the key things we are starting with is community consultation, developing an engagement and a communication plan, so that we are very thoughtful about how are we going to engage stakeholders, how are we going to identify them, how are we going to ensure we can disseminate to them. And then within this, we have 3 aims. One first aim is just generally, we want to produce these predictive models. We don't want it to take so long to implement, yet we don't want to implement something without testing it in the field. So we are going to do rapid cycle evaluations. Just test these models with key stakeholders, get feedback, refine it, then deploy. But we also have an aim to really have data-driven messages. That's where our colleagues at the Graduate Media School come in. How do we develop documentaries, that a young person would be keen to read and see, this is how I improve my mental health. Data says, this is how you protect your well-being. Yeah? So we also have thinking of developing, what is this called? Policymakers workshops, trainings. How do we really engage them, get them to talk? And the last one is really, we've identified and really formed a key stakeholder set of groups, like the Clinton Health Initiative, who have networks all over and can actually use our info, the Aga Khan Health. So, the key benefit of AKU is we lie within the AKDN network. There's this Aga Khan Health Services with amazing networks. How do we deploy to them? So I think dissemination for us, it's not just dissemination, but sustainability. Get it out, get it implemented, and keep it moving. It's really core to our grant, and we are already thinking of how to do this. So I can say it's really well thought in this grant.
So again, on that, one of our listeners is asking, how would the knowledge then traffic in the opposite direction? Whatever we're learning from Uzima in this part of the world, would it have any bearing on any issues, problems, implementation, design in the West or University of Michigan?
Yeah, so I think it's the whole idea of, again, what we've been talking about and maybe alluding to a little bit, this whole idea of reciprocal innovation or reciprocal learning. What I hope and I wish and I envision is that, that we develop a co-created center of reciprocal innovation, bring these ideas back and test them in different settings, see if they work. Doesn't have to work, but at least give it a try. Because clearly, again, the COVID, I think, has in a lot of ways really disrupted society, but allowed us to think differently. And I think it's essential for us to say, well, what if we did things in a different way? What if we didn't have those resources to allow everybody to get colon cancer screening with only a colonoscopy? Is there something different we could do? I'm sure I'm going to get calls from my gastroenterologist friends wondering why I picked colonoscopy as an example. But my point being here is that I think we should learn and embrace the ability to do things differently.
So, Carl?
A couple examples. With our decades of consistent high-quality data, not always nicely organized digitally, but we have the data. We have been able to show things that have been received as important insights in the US. Nutrition, absorption, the functioning of the small intestines, macular degeneration in Pakistan, a big issue. I have no doubt that as our data science team begins to work through the various complex sets of data that we have, that we will develop better algorithms for pulling out information and identifying breakthroughs. So by virtue of 6 countries under one jurisdiction, we can bring many population cohorts under the single university microscope, and we will be able to export our insights back. I think the ability for us to inform conversations far away at the very, very beginning, and what we lack is an organized portal to get this information where it needs to go. Enter our family of collaborating institutions.
Joe, I can see you want to come in.
Just less than 1 minute. First of all, I'd just like to emphasize what Amina was talking about in terms of knowing what works for implementation, knowing what works for sustainability is research. Research is not just about creating new knowledge. It's knowing if it gets applied and if it works and how do you make it better. And I just wanted to make sure that that point was emphasized. The other point I want to make is our burden of disease in maternal health in Michigan is really dreadful in a number of our areas. It rivals what's going on in Africa. The same thing with mental health. So we have done a terrible job with our resources in terms of addressing those parameters. I'm convinced we're going to learn some real pearls and clues here that we can use to transform health back home.
So to the two of you, it's a question here about navigating unique bilateral visions and of the various stakeholders. How do you see this happening without conflict and unnecessary tension that could jeopardize the main goal, which is drive for meaningful impact?
So that's yet to come, clearly. But I think one thing that's the key ingredient is trust, right? I'll tell you that my relationship with Amina blossomed within the last year, but there's a meaningful trust element to that. And I think that's what makes this relationship really, really strong. But we've also engaged trust within the stakeholders already. They're part of our advisory board. We know we have folks from the Ministry of Health and others that we've already engaged early on. I think that transparency, that trust, that early engagement is the key to a successful engagement.
I agree with Akbar. And on top of that, I would just like to add open communication. I think as a team, we've opened it in such a way that you're happy to receive feedback and to give feedback in a respectful manner. And I think we will try and do all this with very open communication. But also, I think one of the lessons I've learned in global health over the years in doing this large collaboration, it's good to have policies early on, expectations discussed. So we're developing those so that as everyone comes in, there is a certain level of understanding. And these are living documents. They will be updated and things will be discussed. But I think these early discussions where you say, how will authorships be shared? How will data be shared? How will we ensure it's equitable and all that makes a huge difference. Sometimes everyone is so excited to start the project, you don't discuss these things. Then 3 years down the line, when all the data is there, is when you start having these kind of discussions. So I think we will benefit from the many years of experience from everyone in the UZIMA team, and then just ensure we keep, the trust, open communication, and very clear guidelines about how members of the hub interact.
So we just about close to the end of the session. So for the two of you gentlemen, I want to ask you to share with us in closing remarks what you're optimistic about with regard to this partnership.
What makes me so optimistic is the combination of clear needs and challenges that are very much in front of us, and then having the kind of talent and energy that I see here in Kenya and at Aga Khan University, that these are the change agents. I can see what they're capable of. And I just want to do everything we can to enable them to do their best work. But what really makes me optimistic is just the level of talent that's involved, the commitment at all levels to achieving success.
Carl?
And over and over and over again, AKU does things that defy the rule books. 6 countries, not seen anywhere else, impossible. A massive institution who has any number of departments bigger than our entire university, embracing us in a shared vision, not supposed to happen. We're audacious, we're nimble, and many, many times we're probably not sufficiently experienced to know that what we're deciding to do won't work because the rule book says it's impossible. So we've talked about many, many things today. I want to give a final shout out, compliment to the deans of AKU. The deans, the directors define the academy within which we live. And you can go so far by exciting the passion of an academic colleagues, but they have families, they need money, they need psychic income, their families need the academic to be happy, and we have to provide them a career path. So here we are, UZIMA, bringing in a whole group of people. Will we use them up and send them back? Or will we bring them in and create an environment where they can see a future? And we have pretty much a whole new cohort of deans at AKU over the last 5 years. And some of the new deans started bringing forward examples like Professor X hasn't been promoted for 15 years because all they do is magnificent clinical work. Well, if we go back to IQRA, I sort of thought that was included. So in part, anticipating UZIMA and Wellcome Trust and others, the deans in the last 12 months have created an entirely new assessment framework for academic performance, for promotion. We've created categories called professors of practice. In medicine, you would call them clinical professors. But we have seen many, many things map onto IQRA that do not translate into peer-reviewed articles, international speeches, grants, and of the sort. So I'd like to publicly acknowledge the efforts of the deans of the university at AKU to take seriously and to maintain rigor, maintain the international norms, but at the same time, identify new, exciting, and innovative ways for our colleagues to have a future of the sort that they want to have with us, so that we don't bring them into Azima, teach them everything we know about data science, and then say, sorry, that doesn't count. Like it just doesn't count. Why would you think we'd get promoted on that stuff? So we're moving way fast away from that. So deans don't always get a shout out. So there it is, to the deans of AKU.
Thank you very much, Carl. And on that note, ladies and gentlemen, we have to bring this to a close. Thank you very much for your questions. I may not have gotten to all of them, but they really strongly inspired the discussion this afternoon and this morning, depending on where you are. So thank you very much, and stay tuned. A lot of exciting opportunities. And for those who would wish to connect with our colleagues, Amina, Abubakar is here, Akbar is here, and you know where to find them. And you know where to find our two leaders in case you have strategic questions to ask going forward. Please do not hesitate to contact. Thank you very much, and thanks for being with us this afternoon.